Welcome to Skin Honestly, the podcast where we talk about skin, aesthetics, and everything your doctor probably didn't have time to explain properly. I'm Dr. Low Chai Ling, aesthetic physician, and I've been doing this for over 20 years, which means I've answered the same questions thousands of times. And I'm finally putting it all in one place.
And I'm Maya. I'm not a doctor. I'm just someone who has questions, and probably the same ones you have. Like, does Botox hurt? Is it safe? And why does it cost $80 at one place and $800 at another?
And I'm Ryan. Maya dragged me here. I'm the guy who thinks all of this is a bit unnecessary, but I agreed to keep an open mind. Emphasis on agreed, not guaranteed.
We'll convert you by the end, Ryan.
We'll see about that.
Okay, Dr. Lowe, let's start from the very beginning. What actually is Botox? Because I've been getting it for 2 years and I realized I don't actually know what it is.
You are not alone. So, Botox, the brand name, is actually botulinum toxin, which sounds immediately terrifying.
Toxin. You're injecting a toxin into your face. That's the thing.
Yes, and you eat antioxidants to fight oxidants in your body, and you take paracetamol, which is technically a drug. Context matters. Botulinum toxin, in tiny, controlled medical doses, is one of the most studied substances in aesthetics. It's been used safely for decades. Originally for medical conditions like muscle spasms and migraines, long before it became an aesthetic treatment.
So it started as medicine.
Exactly. Doctors noticed that patients getting it for muscle spasms also looked more relaxed, less lined, and that's how it crossed over into aesthetics. Happy accident, really.
So how does it actually work? Like, in simple terms.
Okay, think of your muscles like a light switch. Every time you frown, squint, raise your eyebrows, your brain sends a message to the muscle. The switch flips, the muscle contracts, and you get a line. Botox is like putting a tiny piece of tape over that switch. The signal still gets sent, but the switch can't fully flip. The muscle relaxes, the line softens.
So you can still move your face.
If it's done well, absolutely. The goal is never a frozen face. That's a dosing and technique problem, not a Botox problem. A good result looks like you had a really good sleep and haven't been stressed in 3 months.
That's exactly how I want to look permanently.
Okay, here's my question. I've seen ads, $9 per unit Botox, $80 for a full treatment. How? Is that even real Botox?
Great question. And honestly, this is where people get into trouble. There are different brands of botulinum toxin. Botox is a brand name, like Panadol is a brand name for paracetamol. There are other brands, Dysport, Xeomin, Nabota. Some more established, some newer, some cheaper.
Are they as good?
Some are just as good. Some have less data behind them. The issue is, when something is priced suspiciously low, you need to ask, what am I actually getting? Is it a reputable brand? Is it properly stored? Because botulinum toxin is a protein. It needs cold chain storage. If it's been sitting in a warm room or improperly handled, it degrades. You're paying for something that won't work. Or worse, works unpredictably.
So you could pay for Botox and get nothing.
Or very little. Yes, which is actually the best case scenario. The worst case is it's not what they say it is at all.
That's terrifying.
It's why I always say, if the price makes you do a double take, do some due diligence. Ask what brand, ask how it's stored, ask who's injecting it, and what their training is.
What about clinics that charge per injection? I've seen that. Like a certain price per injection point.
This one's interesting. Botox is typically priced per unit. A unit is a standardized measure of the actual toxin. Per injection point pricing sounds appealing. You think, oh, fewer injections, cheaper. But here's what people don't know. The number of injection points has nothing to do with how much product you're getting.
Wait, explain that.
A skilled doctor might inject a forehead in 4 precise points and achieve a beautiful, natural result. A less skilled one might inject 10 points. But if the concentration is ultra diluted or the placement is off, you've just had 10 injections and still don't look great. More injections does not mean more product, and it definitely doesn't mean better results.
So what should you be asking?
Ask how many units you're getting. A typical forehead treatment is somewhere between 10 and 20 units, depending on the person. Frown lines, usually 20 to 25. Crow's feet, 10 to 15 per side. If someone can't tell you the units, that's a red flag.
Huh, I genuinely didn't know any of this.
Most people don't, and clinics that are vague about units are often either diluting the product heavily or they simply don't want you doing the maths.
Okay. Side effects. I need to hear this. Maya keeps saying it's fine, but I want the real answer.
The real answer is, when done correctly by a properly trained doctor using the right product, the risks are genuinely low. The most common thing is bruising at the injection site. Totally normal, resolves in a few days.
I've had that. It's like a tiny bruise. Nothing.
Less commonly, a temporary headache the same day. Very occasionally, if the product migrates slightly, you could get a droopy eyelid or brow. This sounds alarming, but it's temporary. It resolves as the Botox wears off, and a good injector will know how to avoid it through proper technique and placement.
How long does it take to wear off?
Typically 3 to 4 months, which is also why it's a great starting point for anyone curious. It's not permanent. If you hate it, you wait a few months and you're back to baseline.
That's actually reassuring.
The risks go up significantly when you go to someone who isn't properly trained. Aesthetics is a medical procedure. The face has incredibly complex anatomy. Nerves, muscles, blood vessels all very close together. This is not a skill you learn in a weekend course.
Is that happening, though? People doing it after a weekend course?
More than you'd think, and it's a large part of why skin, honestly, exists. Because people deserve to know what questions to ask before they let anyone near their face with a needle.
Ryan, you've been surprisingly quiet. What's the verdict?
I mean, I still think I personally don't need Botox, but I understand it now, and I understand why someone would want it. It's not vanity. It's actually quite considered when you do it right.
That's all I ask. You don't have to want it. You just have to understand it.
I will say, if I ever did do it, I'd go to someone who could tell me the units. I know that much now.
I'll take that as a win. That's it for episode 1 of Skin. Honestly, if you learned something today, share this with someone who has questions about Botox but doesn't know who to ask. That's literally who this podcast is for. Next episode, we're talking about lasers, what they actually do, which ones are safe for Asian skin, and why not all lasers are created equal.
I have so many questions about lasers.
I'll just be here, skeptically.
Find us on Spotify and YouTube.